Hi, my name is Melissa Liley, and this presentation is on delegation. So delegation is defined as a multi-facet decision-making process which is learned and is an essential nursing competency. Allowing a delegatee to perform a specific nursing activity, skill, or procedure that is beyond the delegatee's traditional role and not routinely performed. By Virginia law, the authorization by a registered nurse to an unlicensed person to perform selected nursing tasks and procedures in accordance with the law. Delegation of nursing tasks and procedures shall only occur in accordance with the plan for delegation adopted by the entity responsible for client care. In the judgment of delegating nurse, the task or procedure can be properly and safely performed by the unlicensed person, and delegation does not jeopardize the health, safety, and welfare of the client. The delegated nurse retains responsibility and accountability for the nursing care of the client, including nursing assessment, planning, evaluation, documentation, and supervision. Delegated tasks and procedures are within the knowledge, area of responsibility, and skills of the delegated nurse. The person to whom a nursing task has been delegated is clearly identified to the client as an unlicensed person by a name tag worn while giving client care and by personal communication by the delegating nurse when necessary. Delegated tasks and procedures shall not be reassigned by the unlicensed personnel. An assessment is required before delegation. Delegate only those tasks that do not require the exercise of independent nursing judgment, do not require complex observations or critical decisions with respect to the nursing task or procedure, frequently recur in the routine care of the client or group of clients, do not require repeated performance of nursing assessments, utilize a standard procedure in which the task or procedures can be performed according to exact unchanging directions, and have predictable results, and for which the consequences of performing the task or procedures improperly are minimal and non-life-threatening. So this chart provided is the National Guidelines for Nursing Delegation. This describes the role, function, and collaborative work relationships among those in the role of the employer, nurse leader, licensed nurse, and delegatee. There are 5 rights of delegation: the right task, right circumstance, right person, right supervision, and right direction and communication. So the right task, the question you would ask, is the delegated responsibility appropriate to delegate based on the individual's job description and facility policies and procedures? For the right circumstance, the question would be, is the delegation process appropriate to the situation? Right person, is the prospective delegatee a willing and able employee? Right direction and communication, do the delegator and the delegatee understand a common work-related language, such as time frame, patient needs, and critical? Right supervision, is it clear that the delegatee will provide feedback related to the delegated responsibility when appropriate? There are 4 steps to the nursing delegation. 1, know your resources. Know what tasks can be delegated. 2, build rapport. Establish relationships with staff. 3, communicate clearly and respectfully. Being clear, open, and honest with communication can help with breaks in communicating. Lastly, don't forget to follow up. Just because you gave it to somebody else and crossed it off your list doesn't mean that you are erased from it. Following up is important in delegation. So why is delegation important? It allows a qualified healthcare worker, such as an RN, to transfer routine and low-risk duties to nursing assistive personnel. It frees up the RN's time to focus on more pressing matters. It helps growth and development in all parties involved. It also inspires employees to perform better. There are possible barriers. There's under-delegation, over-delegation, and improper delegation. Under-delegation is where nurses do not have confidence in making effective decisions, they lack time to delegate, or choose to just do the task themselves. Over-delegation is when the delegator overburdens the delegatee with too many responsibilities. And improper delegation is delegating responsibilities beyond the delegatee's training or education. Delegation is a learned skill related to how to make appropriate nursing judgments, achieve nursing goals, and improve person-centered care. Thank you.